Hi, my name's Leanne. I'm the nurse practitioner that works here at iHuman. We have a partnership here at iHuman with the Boyle McCauley Health Centre, which is just a little bit north of iHuman, but we do outreach here for youth and young adults up to the age of 24. So we have a lot of services that we provide for iHuman clients. We provide all sorts of primary care, so that includes everything from medication management, STD checking and screening and treating, prenatal care, birth control. We can do medication management. We also provide harm reduction supplies, no questions asked. We have naloxone kits. We love to give training on that. Sorry. Oh yeah, connections to mental health services, as well as any referrals to specialists that might be appropriate for you. What I love about iHuman is that there's a general understanding of where youth and young adults are coming from. The people that we serve here, I think that there's a lot more acceptance and a lot less judgment that you'll find here at iHuman specifically. iHuman is quite a family. That's the first thing that I noticed when I came to work here, is that everybody cares for one another. The youth care for one another, the staff here care an incredible amount. It's very much a judgment-free zone. It's a come as you are, and we want to help you in whatever ways you feel are going to be beneficial for you. So I really love that about iHuman, and I think that's pretty unique to iHuman and even to Boyle McCauley. I love that iHuman is here because I think Boyle McCauley can be a pretty intimidating place to visit as well. So I love that we are able to provide outreach here where youth feel comfortable, they feel really well connected, they feel supported by the people they will meet here in iHuman. Welcome to the Boyle McCauley Primary Healthcare Clinic in iHuman. Come right this way. So when you first come into clinic, if you want to see the nurses, what you do is head over to the triage room. In here, you're going to find one of our nurses or one of our medical office assistants. They're going to welcome you in. They'll have you sit down, chat a little bit about what brings you in today. They're going to check your blood pressure, your temperature, that kind of stuff. They'll even check your weight. And you can kind of give them a little bit of an idea of what you're in for, what we can help you with today. When you come and see the triage nurse, you might interact with a whole bunch of fun equipment, including, but not limited to, thermometer for temperature check, a stethoscope, plus, let's test your knowledge and see if you know what this thing is called and whether or not I can pronounce it. This is called a sphygmomanometer, and it checks your blood pressure. We have our lovely pulse oximeter, which goes on your finger. And this actually tells, by reading through your nail bed, what your oxygen levels are and your pulse rate. We have a scale. Ta-da. And if the nurse is being mean, they'll only tell you your weight in kilograms and make you do the math. But usually they're gracious enough to tell you in pounds too. And then from there, a lot of the stuff the nurses can actually help you with right here, not necessarily needing to see me, but if they feel like it would be really beneficial for you to come see me, then we head over to my room next.
All right.
This is my exam room. I'm Leanne, the nurse practitioner, by the way. And so in here, again, you'll come have a seat. We'll have a little chat about what's going on for you, what I can help you with, any physical exams we need to do, or any procedures we can do in this room. We've got everything we need in there. I promise I'm not too intimidating. Right. And if you happen to have kids, typically when we're not in COVID times, we have a pediatrician that comes, I think, once a week. And she works out of this room. That's Dr. Baydala. So typically we only really use this room for when our pediatrician is in. We do also see kids here that are children of iHuman youth. I don't mind seeing them at all. I love seeing kids. And so this is that exam room. So pretty much the same kind of setup as mine. You sit here, chat with the pediatrician about whatever's going on, and then she's got all this stuff for doing any physical assessments or exams that she needs to do. All of our health exams and interviews are completely confidential. The only time that we deem it appropriate to share any information would be if we determine that there is a significant health risk to yourself or to someone else involved. That would be the only time that we would be sharing only pertinent information with people that would need to know so that they can help you. That's always our ultimate goal, but absolutely confidential care and treatment. You'll find us to be a very judgment-free zone, especially in the area of things like harm reduction, prenatal care, even things like if you find out that you're pregnant and that's not necessarily something that you are ready for, we can absolutely help you out with those sorts of things. Yeah.
Do you guys help with treatment in some capacity?
Yes, absolutely. So iHuman has some really great resources set up already as far as addictions and treatment and different options that way. But we do complete medical treatment forms. That's often a big part of an application to go into treatment, and we love filling those out for people. So that is definitely something that you can bring to us and we'll complete that for you.
Perfect. And what about other things like if somebody needs a medical note, maybe they don't have the ability to work for whatever reason, or even if it gets even further than that, age.
So if you find yourself in a position where you are not able to work because of medical conditions or especially mental health conditions, we can definitely help you with that. We do provide medical letters, and we can also do age applications if that is an appropriate choice for you, and we're always open to that discussion. So when we're not here at iHuman, any person that is a client of our primary care clinic here at iHuman can access healthcare at the Boyle McCauley Health Centre. So there's always an understanding that if you need help and it's a Monday afternoon, you can come to Boyle McCauley. Boyle McCauley right now is open Monday to Friday from 8 a.m. to 4 p.m. Outside of those hours, unfortunately, we can't help you out too much, but definitely if you were to have some sort of issue, you can either come to iHuman. If it's not a day that we're working, usually the iHuman staff, if they're able to, they'll bring you over to Boyle McCauley, and we can definitely see you there as a walk-in.
And how can people get a hold of you? What's the best way? Or
That's a good question.
If it's not you, because it might not be specifically you.
Yeah, honestly, probably the best thing to do would be to call Boyle McCauley, because they will connect you to one of our nurses that regularly works at iHuman. Just mention that you're an iHuman youth, and they will connect you with the right person as far as coming to see us, or if you need to book an appointment, if you have any questions about our clinic at iHuman, or you can stop in at iHuman. Most of the iHuman staff know all about our clinic and our hours and what we can provide for you. I obviously have a bias, but I happen to think that we are a pretty fun gang, and I hope you come check us out soon.